You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, M.D., M.B.A. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour. Good morning, everyone. Good morning. It's Health Literacy Tuesday here on the Literacy Hour. I hope you all are feeling well this morning. I want you to remember now that the information shared during the Literacy Hour, either by the host or guest, is for educational purposes and doesn't constitute medical, legal, financial, or tax advice. For specific advice applicable to your situation, I want you to contact a licensed certified professional, preferably one with whom you have a relationship. Remember, relationships matter. Thank you again for joining me this morning. Right now, you all, guess what? You're able to catch this show streaming live on 3 different radio stations. The Noble, the historic WMPR 90.1 FM, the voice of the community, serving the greater Jackson area right here in Mississippi, where I got my start in radio at the feet of Dr. Frank McCune, the late Dr. Frank McCune, back when I was a family medicine resident doctor attending the University of Mississippi Medical Center. WFQY 99.1 FM, the little station with the big heart that's been loving on the community by providing the greatest in gospel hits and information since its inception, serving the Byram and Ridgeland communities primarily. But I can hear it all the way in Clinton, Mississippi, so I'm not too sure about it being a little station. And WGDQ 93.1 FM. The way we can remember that station is just think about that handle, WGDQ, where God did it quickly. Well, they're serving the Summerall, the Laurel, and the Hattiesburg communities. All these stations also stream live on their own websites as well. I tell you, technology has really come a long way, and it's not done advancing. You can join me back here on 5th Tuesdays when we discuss all things tech. I want you to do me a favor. I usually ask this of you. Like us on Facebook and Instagram. The handle is TT Solution LLC. And subscribe to our YouTube station, Test Taking Solution Foundation. And that way you'll be notified whenever we're streaming live. Also, you can go to our website and click on the event calendar to check out our community engagement events, ttsfoundation.org. We have so many wonderful events going on all around Jackson that have a lot to do with education and providing information and resources. There are lots of discussions about health equity and health disparities. And we're just all getting into the game because the solution can't be about us without us. And that's just the bottom line. We know our communities better than anyone else. And so we should participate in finding the solutions. The phone line is open, and I want to hear your thoughts as usual, 601-714-8378. That's 601-714-TEST. I do have to get me one of those Bluetooth speakers, though, so that everyone can hear your comments very well. But in the meantime, no worries. I'll just repeat them for the listening audience. Okay? Join me next Tuesday, 3rd Tuesday, when we will talk about financial literacy using the FDIC developed curriculum. Also, I can't wait to see what's hot in the world of economics at that time. If you'd like to be a guest on the show anytime, just call our foundation. Again, that number is 601-714-8378. You don't have to speak to me directly. Whoever answers the phone will get the word to me. You really enjoy the experience of being a guest on this broadcast. All right, I am getting some notes here. Someone is saying that we're not on, but it looks like we are. It says we're live, and so I'm sorry if you're not able to hear the show on WMPR. I just got a note. Thank you so much, listening audience, for sending me those notes. We'll see what's going on over there. I have. Been told that we should be streaming live over there, WMPR 90.1 FM, as well as WFQY 99.1 FM. WMPR is 90.1 FM, and then WGDQ 93.1 FM. Next week, we'll hear from Miss Queen Hatfield, chairwoman of the Jackson NAACP Branch Freedom Fund Banquet, scheduled to be held on July 27th at the historic M.W. Stringer Grand Lodge. Contributions support the branch's civic engagement, their programmatic and scholarship endeavors. And one of our very own Honorable House of Representatives, Zakiya Summers, representing House District 68, has been supporting that endeavor as well. She represents so very well, and she keeps all posted about what's happening in the legislature and about various key bills like the Medicaid expansion bill we followed right here on the Literacy Hour. She does that right on her Facebook page. So if you're not following her, I encourage you to do so today. And while you're over there on Meta, formerly Facebook, find our TT Solution LLC page and follow it too. You'll be able to stay in the know of what's happening with the scholars who attend our after school and summer academic enrichment programs. Hopefully by now they've gotten whatever issues they might be having at WMPR straightened out. If not, again, accept our apologies, and we'll make sure next Tuesday that things are ironed out. Speaking of our summer academic enrichment program, the SAPE, our nonprofit organization, is in the midst of hosting our second annual summer academic enrichment program. It started July 1st and is scheduled to end on August 2nd, culminating with a community-wide event where we will recognize our summer scholar participants, the volunteers, staff, and supporters. This week, our staff has been orienting, reviewing what I like to call the Liddell curriculum. I normally don't coin anything with my name, but I got it. I got to coin this one because this curriculum that I came up with a few years ago to help scholars who struggle academically has really proven to be effective. They don't struggle anymore. Instead, they're more confident in their learning, and they've been learning through play and through being exposed to places and people they otherwise might not be able to readily access. And so we are thrilled that we have found a solution over at Test Taking Solution, and it works. Yes, we are preparing for our SAPE, our Summer Academic Enrichment Program, for Math Mondays, from 1, 2, 3s to calculus. We'll be reviewing it all. Field Trip Tuesdays. Our first trip will be over to Mississippi State University to visit the College of Forest Resources as the guest of Dr. T.J. Walker and his staff. Dr. Walker, for those of you who might not know, he's a renowned gentleman. He's a director of student recruitment and inclusive excellence, and he means business. We're getting ready for Wealth Building Wednesdays. Our foundation is a proud FDIC Money Smart Alliance member. Our scholars don't know this yet, but when they hit the building on Wealth Building Wednesdays, they're going to have to pay an admissions fee. And I know a lot of them won't be able to pay it. I know, because they're broke. They don't have jobs. I mean, from the moment they show up on Wednesdays until they go home, they're going to feel what it feels like to have a need for something but can't access it due to a lack of finances. They're going to gain an appreciation for the dollar. Now, there will be opportunities for them to borrow from either their friends or the bank that we've established called TTS First, inspired by Bank First. And if they don't like the terms of TTS First, they can mosey on over to TT Sant, inspired by Renaissance. And if they don't like those terms, they can try TTS Mark. Yes, you guessed it right, inspired by Trustmark. Sponsorships have been rolling in. Can't thank Walmart Spark for Good enough. They are a gold sponsor, thanks to our community Walmart right off of Highway 18. Thank you, thank you, thank you. Right off of 18 on Greenway Drive. Shop there, you all. That's the Walmart I shop at now. They care about what's going on in our community. Elder First Lieutenant Colonel Mr. Timothy Henderson is a gold sponsor. He didn't have to, but he did. Came out of the woodworks and he gave early on, and he's running for mayor of the city of Jackson. He too has a lot of solutions that he wants to implement. Mr. and Mrs. Ollie Linson are gold sponsors. Doctors Celeste and Clyde Glenn, both board-certified psychiatrists who attended the same medical school as I did, have pledged at the gold sponsor level. Ephraim Farm LLC is a gold sponsor in kind. Mr. Ephraim and his team did a lot to help us get ready for the program. We're so grateful for them. Clinton Area Kroger is an in-kind sponsor as well. They'll make sure that our scholars are properly hydrated during our field trips. Clear Cut Forestry Mulching, where Mr. Ralph Peterson is the CEO, always surprises us with a donation, and he donated in a big way, and we're very, very happy about it. We Care Church donated. Astro Heating and Cooling LLC donated. Richard's Front Wheel Drive and Auto Repair of Byram donated in a big way. And boy, they're doing big things over there in Byram. I've taken my car over there several times, gonna take it back. Mr. Joshua is running the front. And he has a great name, named after my son, my goodness. And so, or the same name as my son. They're both named after the biblical character Joshua. And that's a leader. And boy, he's leading in a great way over there at Richard's Front Wheel Drive and Auto Repair. Mr. Willie McGinnis donated in a big way as well. Minister Nancy Gaynor of Grandparents Really Do Matter gave. Miss Alice Toombs, who's been sponsoring 2 students all year long. I'm talking about students who weren't doing so well and making F's on their report card. She said, I know we can help them do better, Dr. Liddell, and I want to help them access high quality tutoring. Well, hey, I don't have to tell you, and I'm not bragging. The proof is in the pudding. You can talk to the students. You can talk to their parents. They will tell you that those F's turned into A's and B's, and that child went on, progressed to the next grade level by the end of the school year. Thank you, Ms. Toombs, for sponsoring a child for the Summer Academic Enrichment Program. Mr. Rufus Palmer is helping to sponsor the SAPE as well. Mrs. Carol Frazier, whose beautiful grandchildren are TTS scholars. They're such a delight to tutor, and they're smart as whips. Mrs. Frazier is sponsoring a child. An anonymous donor gave $5. Again, I shared with you last week, and I'll keep sharing it from the rooftop. We're grateful for it. Listen, no amount is too small. There are so many needs when you're running an operation of this caliber. Dr. Salika Sweet, diplomat of the Board of Family Medicine, continues her support. And she's been so passionate about helping to build up and lift up our next generation of leaders. So very quietly doing what she does, and she didn't just start. She's been supporting test-taking solutions since the beginning. Thank you, Dr. Sweet. 2 beautiful ladies, Mrs. Carolyn Smith and Mrs. Kathleen Hodge Tyler, walked into our center yesterday and blessed us with enough in sponsorships to cover all the entry fees for all the children to get into the museums, the zoo, and the other places we'll travel to on Field Trip Tuesdays. They didn't have to, but they did. They have little ones who attend Test Taking Solutions after school program, and they, like all of our families, support their scholars to no end. Thank you, Miss Smith. Thank you, Miss Tyler. Listen, you all, if you're not going to support them, don't have them. Or have them and give them to someone who will love and support them from the cradle to the grave. Children need to be loved and supported. They're children. And yes, they're going to make mistakes. Don't you remember making mistakes as a child? A child is supposed to. And that's partly how they learn. Our board of directors has been notified by Atmos Energy that they will be donating. And I'm not sure at what level yet, but I hope they know that we will be thankful for whatever they decide to give or do. And we will be accountable for every cent. So we have raised a total of $4,000. And that's enough to cover a lot of what we need for the SAPE. Staffing is always the biggest budget item. A lot of people with programs like this sometimes expect folks to volunteer all summer long for free, but we have to be realistic and understand people have bills to pay. They have households to run. We cannot ask, I dare not ask any grown person to volunteer their time 8 to 5 every single day doing what we do. No, it's too much and it's too hard of work to ask someone to do that. So staffing is always the biggest budget item, and I do my very best to take care of that. You guys have helped to take care of the children. So do you realize that because of your donations and pledges, let me tell you something. Not a single child living in poverty is going to have to pay to attend this year's SAPE. You did that. I'm speechless about it. The families are so grateful. A few of them have come to tears because they thought that they would not be able to afford to send their child to SAPE, and you came right on through and blessed them. So you'll be hearing from them, I'm sure of it, because they want you to know how thankful they are. If you follow us on Facebook or Instagram, you may have seen our notification about how we've been blessed to get that mini charter bus I wanted us to have. I want our children to ride in style. I know how impactful it is to step into something nice or up on something nice. It elevates you. It makes you feel better. And so, no, nothing spectacular happened in terms of a donor or a supporter coming through. The owner of the bus line herself, Ms. Vanessa Green, just provided us with much more favorable terms that we can now afford over a period of time. I'm so grateful for her and for her company, Anointed Tours. It's been just that. It's been just that to work with, anointed. She recently lost her husband. So under the sound of my voice, you all, I want y'all to take a moment to just think about her and anyone else whom you know who has lost someone he or she loves. I'm thinking about my mom. I'm thinking about Mrs. Vanessa Green. My mom lost her son. I lost my brother, and that's still been a very hard thing for her to cope with. We miss him dearly. So I want you again right now just to lift up anyone that you know of who has lost someone, encourage them, support them. Don't forget about them. We'll never forget Miss Vanessa Green for her kindness. So let's just take a moment to do that, you all. Lift them up. Yeah, it's tough. It's tough when you lose someone you love, someone that you're accustomed to seeing every day or quite regularly, someone who helps to pay the bills, someone who helps to take care of the car. It's tough. But Miss Green, I want you to know that we're praying for you and the community is here. Mom, I want you to know I love you and I'm always here. You know that. So thank you, listening audience. You're all so amazing. And I'm glad to call you the listening audience of the Literacy Hour. Yes, you have an official title now. You're prayer warriors. It's because of your support and prayers that we're still on the air. The main goal of this talk show is to mitigate health disparities, and one way we accomplish this goal is by enhancing our overall literacy skills and engaging our community in such a way that we become more educated, more empowered, more enlightened, and we're moved to action to improve the state of affairs in our community because something shows us and tells us that we can. And so we can improve our education. Yes, we can improve our health, even our finances, our overall well being. The call in number again is 601-714-8378. And you never can tell with this technology who just might pop in and grace us with their presence. So I'm very grateful and pleased that we have WMPR 90.1 FM and that we have WFQY 99.1 FM and WGDQ 93.1 FM. However, you're listening in this morning, we're just so grateful and we're so thankful for those stations. Today, on this second Tuesday, we focus on health literacy, the degree to which individuals have the ability to find, to understand, and to use information. You see, it's not enough to just be able to find the information. I mean, that's one thing. But we have to be able to understand what we have found. And then after we've understood it, we have to be able to apply this information, apply these services to our lives. Otherwise, it's no good. It's no good. We can't act on what we don't know. We can't inform our health-related decisions and the actions that we take for ourselves and for others. So thank you for tuning in to the Health Literacy Tuesday on the Literacy Hour. Firearm violence has been declared a public health crisis by our U.S. Surgeon General. U.S. Surgeon General Vivek Murthy declared firearm violence a public health crisis. He must have visited Jackson. We already knew it was a public health crisis down here. It is just beyond crazy, okay? That we're dealing with anger. We're managing our anger, and because we're mad at somebody, frustrated, disappointed, by picking up a gun. So yes, Dr. Murthy has declared firearm violence a public health crisis. We got to do something about it. Gun deaths and injuries punctuate our daily lives here in America. On nearly every day of 2024 thus far, a burst of gunfire has hit at least 4 people somewhere in the country. Some days, communities have endured 4 or 5 such shootings. The nation's top doctor called on policymakers to consider gun safety measures such as bans on assault weapons and high-capacity ammunition magazines and universal background checks for all firearm purchases. His advisory also urges a significant increase in funding. See, I told you, when you want to solve any problem, you're going to, first of all, have to pray about that thing. At least in my own life, that's what I have found is a top number 1 ingredient, prayer. It changes things. Secondly, you have to bring experts to the table. Folks who are good at what they do, know what they're talking about. And I'm sure Dr. Murthy arranged for several experts to come together. And I'm sure they met, they reviewed literature, they talked about the issue, and then they decided how much funding is needed for the solution. And so he has urged a significant increase in funding for research on gun injuries and deaths, as well as greater access to mental health care and trauma-informed resources for people who have experienced firearm violence, because there is an aftermath to this thing. And not just to the families, the victims who are affected, but those who are close to them. And so thank you, Dr. Murthy, for putting the advisory out. But thank you more so for asking for increased funding for research. We have to figure out what's going on. I read a New England Journal of Medicine article recently, and it's called Increasing Firearm-Related Deaths Among U.S. Black Rural Youths. After decades of decline, the United States saw a nearly 20% increase in all-cause mortality among children and adolescents 1 to 19 years of age. Hereafter, we refer to them as youths, from 2019 through 2021. And this increase can be attributed to an accelerating upward trend in firearm-related deaths, disproportionately concentrated among our Black youth. I said it, and the New England Journal of Medicine reported it. And so it is true, it's reputable information that firearm related deaths are disproportionately affecting Black youth. And you wonder why we want to have a summer academic program, get them out of the city, let them see bigger things, let them have their minds to be focused and elevated on something else. You know, there's this old saying that an idle mind is the devil's workshop. We don't want them to be idle this summer. Dr. Lumumba, I shared with you last week during Education Literacy Tuesday that she encouraged our youth all around Jackson to read, pick up a book this summer, do something productive. And I'm echoing exactly what she said. So thank you so very much. Mr. Jones, you're on the air. Yes, sir. I'm listening.
We're going to use the telephone. We haven't taken.
Okay, that's fine. Thank you so much. For those of you who have been reporting that we've had some issues at WMPR, the producer just said he's going to get you all connected. For the rest of you, I see that you're on live stream. Thank you very much. And you're doing what you do. We're going to keep going. Oh my goodness, it looks like we've been graced with the presence of Dr. Daniel Etney as well. For those of you who are live on the live stream, you actually can see him. Dr. Etney, we're so happy to have you this morning, sir. Can you speak back? Say that again, Dr. Etney.
Are you able to hear me?
Oh, we can hear you perfectly, sir.
Wonderful. I'm so glad to be with you this morning.
Well, I'm glad that you're here. Listen, I was just talking about this increasing firearm-related deaths among U.S. Black rural youth. It has become a topic of discussion now, and many of us have been having this discussion for quite some time right here on the ground. And so what say ye about this?
Yeah, I was listening to you and so glad that you were addressing the issue, and so glad the Surgeon General is addressing the issue. Yet again, we in Mississippi lead the nation in an adverse way in that we have the highest rate of firearm deaths of any other state in the nation, and firearm related deaths have become a principal cause of child related deaths. And it's accidents kill more children than anything, and firearm accidents are going up more and more, and it's becoming a significant public health issue nationwide. Certainly mass shootings are a horrible issue that really falls more into the mental health category than the public health category. We have to get our arms around that. But from a public health standpoint, what's killing the largest number of our folks with firearm related deaths are accidental shootings and then homicides. And the accidental shootings are so preventable. Homicides got to deal with the criminal component, but the accidental deaths, where we can just through proper education, safety techniques, and then what we're seeing in public health, very strong evidence, Dr. Liddell, that to help reduce the firearm deaths that are related to mental health issues, that proper intervention during a mental health crisis with what people call the red flag laws, which is where if you're in the midst of a mental health crisis and a competent medical professional identifies it, that firearms are temporarily taken and stored safely. until that crisis is over and they're deemed to be okay again. That has shown strong evidence. And then just basics of proper storage.
Proper storage.
And there are legal firearms all over the state of Mississippi, and public health has no interest in confiscating firearms. But what we're seeing in the public health literature is that just simple storage techniques, handgun safes within the homes, proper storage of long guns, like I do in my home. I've an avid hunter, but I've got grandchildren, and my shotguns and rifles are properly stored and secured. So it's nothing in public health has been looking at gun control as much as safe storage and access to mental health and proper intervention during mental health crises as we continue to get more data. So for us in public health, we're not driven by political ideology, as you
That's
will.
right.
We're driven by the data, and this is where the data is driving us.
You got it. That's exactly what this New England Journal of Medicine article reported, that firearm related mortality amongst youth has increased since 1999. You all, most notably amongst Black
Yeah.
rural youth, who make up only 9% of the Black youth population. So, a small percentage of the population, a large percentage of those being killed by firearms. And so, this study has revealed a critical, overlooked aspect of rising youth mortality. There's been a quadrupling of firearm related deaths. Quadrupling. Thank you all for listening to the Literacy Hour. Quadrupling 4 times. 4 times, okay? And so this is primarily due to homicides. And we're just so happy to have the perspective of our top doctor. Dr. Etney is our Chief Health Officer of the state of Mississippi Department of Health. And we're so happy to have him here with us this morning. Dr. Etney, while I have you on, I actually want to talk about some few other very important public health items. Do you have time?
Absolutely.
Let's talk a little bit about the heat advisory. This week, 91 major cities across the U.S. are forecast to have dangerous levels of heat on one or more days. And I have been seeing this sort of spike in health related emergency room visits, being hit by this heat wave. And so we want people to stay safe during the high temperature days. What do you want to share with the listening audience about heat related illnesses?
It, and Lord, all of us who have grown up in Mississippi fully understand the dangers of heat. But
Yes,
I don't know about you. Last summer was the hottest summer of my life, and I'm
I
62 years
agree.
old.
I
And,
agree.
I had to chop cotton 2 summers up in the Delta as a young man, and I know the heat, but hadn't experienced anything like last year, and it's looking
Mm,
like a hot one this year. And what we're doing at the health department, I have in my emergency response team uh, meteorological expertise, and I have them monitoring the heat index for our state, every day, and looking at the heat forecast for the week to alert me should we move into the danger zone, which I know that we will by
yes,
by next month, certainly. But it's hot enough now that we all need to take our usual precautions of just using some common sense, especially folks like me that are older. And if you're taking, medication for your heart, your blood
yes,
pressure, your diabetes, you have to be especially careful and make sure if you have to work outside that and you have the option that you do it in the cool of the morning and the cool of the evening. Do not do it in the middle of the day, and hydrate. That is critically important. And what we have to tell folks is you don't just drink to thirst, you drink past it. You drink until your thirst is quenched, and then you drink some more because you will lose your volume of water very, very quickly in this heat and humidity. And look out for your pets. Don't just leave them out without enough water and shade. And if we're going to look after our pets, we need to look after, our older family, friends, and neighbors who, older folks are uh, just aren't able to sense heat changes as quickly or as well. They don't sense the symptoms of dehydration as quickly as when we were younger. So we need to check on each other, make sure that folks that are shut-ins, that their air conditioners are working, that their fans are working, that they're okay, that they have plenty of opportunity to hydrate, and encourage them to hydrate. And what I always told my patients is that just watch the color of your urine, and if your urine's getting dark, you're dehydrating. You
Mm,
know, during
that's a
the
sign.
summertime, pay attention and drink enough water so that your urine is staying on lighter in color and not getting darker on you.
That's right. And so you've heard from our chief health officer, proper storage of those guns to help curb preventable deaths for those of you just joining the show, and drinking until your thirst is quenched, and then drink some more. Look out for your pets. If your urine is getting darker, you want to start drinking more fluids. You also want to visit your healthcare provider, your physician or other provider, nurse practitioner, physician assistant, whomever you have a relationship with. Don't wait around now, okay? We want you to get in and be seen. There are many in our state who still live in poverty, and that's why I'm glad to announce the Mississippi's annual sales tax holiday taking place between 12:01 a.m. this Friday, July 12th, and 12 o'clock midnight, Sunday, July 14th. Two key strategies in combating poverty are eliminating illiteracy, and that's what we're doing right here on the Literacy Hour, trying to do everything we can to ensure that our communities thrive. Everyone, please pass the word that over at Test Taking Solution Foundation, we're serving breakfast and lunch to students ages 18 and under. We served chicken fingers the other day, and yesterday they had Salisbury steak and some cream potatoes, and I tell you, they don't put any seasoning on this food. They make sure to keep the salt intake down. The children have a choice of white milk or chocolate milk. The same food they eat there in the cafeterias at their schools. So we want to ensure children have access to nutritious meals and snacks this summer, you all. The USDA's Summer Food Service Program is the reason for this nice amenity being provided to our students this summer. It's the Summer Meals Program. Again, we're here in the studio, WFQY 99.1 FM, streaming live on WMPR 90.1 FM and WGDQ. God did it quickly. Also on our YouTube channel, we are blessed with the presence of Dr. Daniel Etney, our Chief Health Officer. And we want to talk about a few other things while we have him here. Such an exceptional physician, but also very knowledgeable. And you see, he didn't know these questions that I'm asking here this morning. He didn't have to because he's been so well trained, and he and his team are focusing on these same issues that these researchers are studying, you all. Why? Because he cares. And I'm not saying it because he's sitting here. You know, if you've been listening to the Literacy Hour, I tell you every second Tuesday, which is our Health Literacy Tuesday, that we have a chief health officer and his team who cares about the health of all Mississippians. And so I want you to know, someone sent a question in, and then every now and then, I'm going to respond to these questions live. One question I received before we move into talking about infectious diseases is this. It said, Dr. Liddell, what about a multivitamin? Someone told me to take one every day, and I've been doing that. But every time I go back and forth to the store, it looks like they're upping these prices. Well, thank you for your question, caller. I was speaking recently at Belmont Baptist Church. Again, anything I share with you, you can fact check it, okay? And they asked that same question, or someone posted, and I shared with them then, and I'll share with you this morning. There is no evidence to support daily multivitamin use to improve life expectancy among healthy adults. As a matter of fact, there have been some studies published in JAMA. I've told you about the Journal of American Medical Association. A full third of American adults take multivitamins despite prior studies suggesting they do little to boost health. Dr. Etney, I want you to comment on this as well, sir, and then they will have heard from the both of us this morning.
No, absolutely. You're exactly right. There, the only need for multivitamins are in specific medical conditions, and certainly there may be times that your physician will advise you to take vitamins. Always, our uh, pregnant moms need to be taking the prenatal vitamins, which helps to reduce the risk of congenital birth defects. And then, if you're trying to get pregnant, it's not a bad idea to take prenatal vitamins so that, should you get pregnant, you'll be in good shape with folic acid and B12. But, just normal day to day stuff, vitamins are just a great way to make your urine more expensive. And the other thing to understand, they are not, vitamins, unless you're getting a prescription vitamin like a prenatal vitamin or a prescription vitamin from your pharmacist behind the counter. The over the counter vitamins are not FDA regulated. There's no real testing. There's no continuity. And I always tell my patients, if you're just bound and determined, then if you're going to take a multivitamin, then you need to stick with one and don't jump brands, because as soon as you jump brands, you just change to a whole different formulation of who knows what concentration.
You
So
got it.
I don't, I personally, Dr. Liddell, don't take vitamins, but, every day. If I'm in the midst of an acute illness, then I will for a short period of time just to give my body everything it needs to fight infection. But that's very, infrequently. But you and I, preach for our women to get, good, healthy prenatal care, and prenatal vitamins are critically important at that stage. And then there's some folks that have nutritional deficiencies that would need them, but that would be under a physician's care. And typically, in that situation, then I was prescribing the vitamins. They were getting a prescription vitamin in
Yes.
that situation. But I can't tell you how many times I had this conversation over 32 years of private practice with patients about this, and it's rarely going to cause any harm, but that was always my saying. Well, it's a good way to make your urine more expensive.
I love it. And I love that saying. And so, just to reiterate for our listening audience, if you're pregnant or considering becoming pregnant, prenatal vitamins, please get a prescription from your physician or other healthcare provider or the pharmacist. Folic acid, vitamin B12, those prenatal vitamins help to curb some of those potential congenital issues that some women face. Nutritional deficiencies, get a prescription from your physician. All right, let's talk about infections for a moment. I did see an article recently that said Moderna has been paid by the United States, or is going to be $176 million to develop an mRNA pandemic flu vaccine. And it could be used to treat bird flu in people, because this concern, Dr. Etney, has been growing about cases in dairy cows across the country. And I've had a few farmers to call in and to ask me about this flu. This cow flu is what they've been calling it. Moderna already has a bird flu vaccine in very early stage testing using that same mRNA technology that they use to rapidly develop and roll out those COVID-19 vaccines. And speaking of the COVID-19 vaccines, COVID-19 infections have been growing across most of the U.S., according to the CDC lately. People have been being diagnosed with the coronavirus infection. They say it's been growing in 44 states. What are we seeing here in our state, Dr. Etney?
We're seeing an uptick as well, and certainly in the Vicksburg area, just anecdotally, we've seen increase in COVID infections in our community. It's
Mm,
overwhelming spike by any means, but this is what we're going to see with this bug for I think
it
probably
is.
alone is it's not going away, and it will continue to percolate, and then it will flare up from time to time, then calm back down. And then we just continue to watch the genetic profile of the virus to see if it's mutating in a dangerous way. And right now it is not. And we're looking at our normal winter surge with flu and RSV and COVID, as we've been seeing the last 4 years. And we're already preparing the new version of the COVID vaccine for the variant that's growing in predominance in around the nation and in Mississippi. So one thing we do in our public health lab at the Department of Health is we are testing the type of COVID cases that are out there, and we have clinics around the state that will send samples to our lab who can do the genetic profiling of the virus, and so we know exactly what type of COVID is out there, and it is shifting uh, from an X variant to a J variant, but it's not any more dangerous. But it's I don't take my I've been taking flu shots, Dr. Liddell, since I was in medical school 100 years
Yes,
ago,
I have too.
and I've never taken I haven't been taking the flu shot to keep me from getting the flu. I've been taking the flu shot to keep me from getting really, really sick from the
Sick.
flu.
That's
Now at
right.
62, I'm taking my flu shot so I don't die from the flu. And if I get a case of the flu after my flu shot, it's going to be attenuated. It's not going to be nearly as severe than without the shot. And the same is true with COVID. So we definitely are advising, uh, you know, everyone to get their flu shots and their COVID shots 6 weeks and older. But the older you are, then the higher risk you are of severe illness and death. And it's just it's not worth taking the chance. So the vast majority of folks that are getting COVID are they're they're pretty sick for 2-3 days, and then they're bouncing back just fine. But we're still having people die of COVID every month. Most of them are our 70 and 80-year-old folks. We still are having deaths in nursing homes related to COVID. So COVID is not gone. It's just under control. We have enough population immunity. Virtually everybody has either had COVID, many have had it 2, 3, 4 times, or vaccinated, like I've been since I was blessed, from the beginning
Yeah.
as a healthcare provider to get the vaccine, in 2020, very early. The the population just has an awful lot of immunity now that we did not have in 2020, and
Yeah.
so that's why we're not seeing the horrible number of cases that we used to see. And the only way we'll ever see uh, times like we did in 2020 and 2021 will be if there's a mutation of the virus, and all of a sudden none of us have immunity again. So I don't want to jinx myself, but
Yeah.
I just I take care of myself. I keep my boosters up to date, and I'm still a unicorn with COVID. I have not gotten it. Um,
Oh, wow.
but I know I'm going to get it sometime. But my goal is not to die from the thing.
I
So
agree with you.
with the flu, what you're talking about with Moderna experimentation is the holy grail for us in public health is to achieve a universal flu vaccine
Yes.
instead of
It's
what we're having to do every year. We're having to do the same thing with flu that we're doing with COVID, and that is to predict what's going to hit us and then develop the flu shot in advance of that, and then pray that we get it right. And there's some years, as you know, we've not gotten it right.
that's
The
right.
the flu shot formulation just didn't cover the strains of flu going through the community. Most of the time, we do get it right. But the holy grail is to have that one shot that will cover all forms of flu, and including the super flu. And y'all,
Mm,
COVID was, and I know
yes.
how horrible it was. It's the darkest times of my life as a physician. Was fighting COVID on in the ICUs and the nursing homes and in my clinic. Those 2 years, uh, we that was not the super flu. That was not what we saw in 1918
Mm,
with the Spanish flu pandemic. In 1918, we had 12-year-olds that woke up healthy, would go to school, and would be dead by bedtime. You know,
that's right.
that's super flu,
That's super flu.
and that's what we're really trying to guard against. And we invest millions of dollars every year monitoring what's going on in the avian population, especially in Southeast Asia, because that's where superflu will originate. It'll come out of birds, ducks, geese, and then jump to us. So so the H5N1 outbreak right now, the
The
highly
bird flu.
highly pathogenic avian influenza that's going on in dairy cattle right now, has been under intense observation because it jumped from birds to cows, and then it jumped to a few humans. We've only had 4 confirmed cases, but so when it jumps to species, it has an opportunity to mutate, and it gives us a lot more concern. So I'm so glad that you have dairy farmers who are contacting you, and please,
Yes.
the word that anyone in the dairy cattle or in the cattle industry period who wants uh, protection, the health department has free PPE for those workers. So that would be face masks, face shields, gowns, and gloves. Of course, in this heat, there's no way you can work in full gowning and all that. But if you're dealing with a cow that looks like it's sick, our farmers need to be putting on face shields and a mask and gloves at the very least, so that they don't catch it if it is avian influenza. We've had no cases in Mississippi. We have no cases in the cattle of any type herd, dairy or regular cattle. But we're working closely with the Agriculture Commission to monitor it.
Well, I appreciate it, Dr. Etney. I mean, you are our mini CDC right here on the ground in Mississippi. And that's how I refer to you, because you're keeping our state healthy by putting these announcements out on the website. Those of you who've been listening to the Literacy Hour, I love this website, MSDH. That's Mississippi State Department of Health, msdh.ms.gov. Go there and you will agree with me. I'm sure you're going to be calling my office today, as some of you do when I get off the air, and you're going to thank me for sharing this site with you. It is chock full of information, some of the same things that Dr. Etney has shared this morning. I want you to know that they are monitoring things, and COVID is not gone. It's just under control. COVID vaccines work to attenuate the disease should you get it. So we're not taking a COVID vaccine, to say, well, we're never going to get COVID. We very well might, but it will help us to have less complications, if you will. If you have chronic health conditions, get the vaccine. Consider getting the flu vaccine as well. Listen, these vaccines are not perfect, but they help, because most of the time we get the formulation right. I want to encourage our listening audience to wash your hands, socially distance. You don't have to be right up on folks when you're talking to them. You give yourself a little distance. Wear PPE. Farmers, you heard it from our chief health officer. PPE, personal protective equipment. Now, normally I'll give you a test. And we'll give some prizes away at the end of the call. But this morning, we're so blessed to have Dr. Etney here with us. I'm going to forego the little competitions and we'll do those perhaps next Tuesday. So certainly tune back in. But PPE, it stands for personal protective equipment, face shields, masks, gloves, and guess where you can get them from? Our county health department. Yes, walk on in. Tell them that Dr. Etney sent you. Okay, if you did, you don't have to say that, but if you do, they'll know that you heard from our chief health officer himself that this resource is available. Now, Dr. Etney, when you say you've been monitoring for mutations, there are some in our listening audience who did not even know that we have a public health lab. That laboratory science is a real career. And so during our summer academic enrichment program, we have what's called Scientific Friday. And man, do I have some experiments lined up for our youth. They're going to just have a ball with Scientific Friday. So speak a little bit about that public health lab. And then I want to end the show today talking about what the World Health Organization has defined as a major increase in sexually transmitted infections with a special emphasis on syphilis this morning. So talk to us about the public health lab.
Well, Dr. Liddell, it is a wonderful resource for our state and has been for decades. It is the highest level lab that exists in the state. It's where all of our biological testing occurs. It's where we're able to do high level testing for TB and can do genetic sequencing, which is where we can actually see what the DNA pattern is and look quickly for drug resistance. So, uh, we're not wasting our time using the wrong medicines for TB. Same thing with fungal infections, which are difficult to treat and they're difficult to identify. Uh, all of the viral testing that our hospitals around the state are just not able to do themselves, they will send to us. We do all the testing for the water samples around the state to keep your water supply safe. Your milk supply is tested at the public health lab to make sure the milk you drink is safe. And just when the pandemic hit, it was the public health lab that generated the first iteration of COVID testing in the state. The public health,
Ah,
the first to be able to do COVID testing, and that's our job. Is and then also we are testing other labs to make sure that their accuracies are appropriate and maintain the certification of other labs doing a certain type of testing, including the cannabis industry labs. We make sure that they're not just out there on their own doing what they want. Our public health lab is making sure that they're doing testing the way they're supposed to do. And then the EPA and CMS and the CDC are testing and validating our lab. So whenever you hear about positive water test and they're making some pushback that the public health lab got it wrong, I will put my money every day on the public health lab because I know the caliber of that testing and how closely their testing is scrutinized by many federal agencies. So this is not a run of the mill lab. This is a world class lab working every day to keep the people of Mississippi safe.
thank you so much for informing us about the public health lab. Yes, I have, when I was actively practicing, sent samples to the lab as well. And I remember at the height of COVID, when I was at Jackson Hines Comprehensive Health Center, who helped to set up the monoclonal antibody therapy unit. And again, your lab was involved in educating and helping with that as well. So thank you again, Dr. Etney. I want to switch gears a little bit. We have a little time left here. Last week, our listening audience has already been informed about what syphilis is, and they know that there are 4 curable STIs, sexually transmitted infections: chlamydia, gonorrhea, syphilis, trichomoniasis. So trichomona, you all, they're accounting for more than 1 million infections globally every day. Cases of syphilis among people age 15 to 49 years has increased by more than 1 million worldwide since 2020. 2022. We got to get a handle on this syphilis outbreak. And Mississippi has some of the highest cases of STDs and HIV infection in the country. We're going to be talking about this issue all month long. Dr. Etney, I know your team is on top of this because I heard from Dr. Justin Turner during the recent Mississippi Medical and Surgical Association conference. Any updates you'd like to provide the listening audience about what we're doing to get a handle on syphilis?
Yes, take it very seriously, especially ladies, because it's much more difficult for ladies to realize that they have syphilis than for men because the infection is begins internally. And the my biggest concern is the rate of rise that has occurred in women of childbearing age, which
And
has
Dr. Eddie, stop right there. Let's do a little station break. The producer is
okay.
let's do a station break and stations, if you can, give us a few minutes on the other side. We had some technical difficulties at WMPR 90.1 FM, WFQY 99.1 FM, and WGDQ 93.1 FM are locked and loaded. We'll be back on the other side.
Serving Central Mississippi, Alabama, Louisiana, and Arkansas.
All right, and we are back, everyone. We are here with Dr. Daniel Etney. I know I've gotten messages. Somebody doesn't even want to go in to work. They want to stay in their car and listen to you, Dr. Etney. And so I'm sending them a note, telling them, no, don't get fired. But we will be having this discussion all month long and probably even in August. We're going to talk about it until we get a handle on it. So go ahead, Dr. Etney, pick up where you left off, talking about syphilis and what we're doing to get a handle on it here in the state.
And with the rate of rise among our women of childbearing age, it has spilled over into the pregnancies themselves, and so our babies are getting infected, and that's called congenital syphilis, as you know. And Dr. Liddell, the most frustrating thing for me as the chief public health official is in the 1990s we had syphilis whipped. It
Yes.
was erratic.
It was gone.
And now it is worse than it has ever been in my lifetime, and it has reached a crisis point, and everybody needs to be aware of this, and don't assume that, well, I behave myself, I'm okay, you know, unless you know that you know that you know your partner behaves. You don't know. So everybody needs to protect themselves, and especially our young folks need to protect themselves. But it's what we're doing at the health department is we're continuing on with good public health strategies, but it's not enough right now in the crisis. So we are attacking syphilis with every option that we have in our highest risk counties, which are Jones County, Forest County, DeSoto County, Hines County, Harrison County, and Lauderdale counties. So a lot of your listeners are living, in the
Yes,
Hines
ma'am.
area, and that's a very high risk. But you've got listeners in many of these other counties. There's no safe county, but these 6 counties are dangerous counties. And in those counties, we are doing things like partnering with the hospitals to screen everyone coming through the ER. Where, if you are thinking about getting pregnant, go ahead and get screened. You can go to the health department and get screened today for syphilis. Um, make sure that you don't have it before you get pregnant. And if you are pregnant, you must be tested 3 times in pregnancy, for, first trimester, or as soon as you start prenatal care, the early in the 3rd trimester, and then again after delivery, to make sure that we don't miss cases of syphilis that in the baby, because it can and will kill babies. And
Well,
if
and I'm so glad you said that, Dr. Etney. As we prepare to close here today, I do want to share with everyone or echo what you shared. But guys, you need to know the Centers for Disease Control and Prevention, CDC, has found that the percentage of students reporting sexual behaviors decreased significantly from 93 to 2021. And while it has trended downward in recent years, the percentage is still higher for the state of Mississippi compared to the nation as a whole.
It is.
6% of our high school students are reporting having first experienced sex before the age of 13. We want our listening audience to be informed. We must get a handle. We must educate. Educate. You heard Dr. Etney list off those 6 counties that are hot spot areas right now. And you've heard that they're working with local hospitals, ERs to get people tested. But he's also put together a task force to focus on this issue. Why? Because he cares. He's not just blowing smoke and talking about things that are ailing our state, but doing something about it. And we want you to do your part. Dr. Etney, any closing words, sir, about this task force or anything else you want to share with the listening audience?
No, just know that treatment is available for everybody. When it comes to syphilis, testing and treatment is guaranteed for everybody, whether you have insurance or not. Know that your health departments are there for you. We're working hard to get them stronger and healthier for the future. And Dr. Liddell, we appreciate the good work that you're doing, not just with health literacy and promoting health messaging at the level that you do, but also helping to improve the education outcomes for our little ones. And I just want to tell you, we got a great score in education again this week.
We
And
sure did.
folks like you that are making the difference, and you and other ministries and community partners are not getting the credit that you deserve for helping our little ones do better with reading and education overall. So I want to thank you.
Oh, thank you, Dr. Eddie. Listen, we're so excited. You're going to be seeing some pictures of them behaving so well during their field trips and just represent the state well. They're becoming educated. I wish you could see them on Wealth Building Wednesdays, man. They might try to borrow some money from you. They get broke real quickly on those days. Listen, thank you everyone for tuning in to the Literacy Hour here on our YouTube station, Test Taking Solution Foundation, WMPR 90.1 FM, FQY over at 99.1 FM, and WGDQ, where God did it quickly, down in Hattiesburg, Sumrall, Laurel communities, WGDQ 93.1 FM. Have a great rest of the day. We'll see you back here next Tuesday. Thank you, Dr. Etney, again, sir. Have a wonderful day.
Bye-bye.
For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, M.B.A. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation
Here on our podcast live stream at affiliate stations.